Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
What's next in the ongoing fight against coronavirus? Tonight on Behind the Headlines. I'm Eric Barnes with the Daily Memphian. Thanks for joining us as we continue to do the show remotely. I am joined today by Dr. Alyssa Haushalter, Director of the Shelby County Health Department. Thank you for joining us.
Thank you for having me.
Along with Dr. Stephen Threlkeld, Medical Director for Infectious Diseases at Baptist Memorial Healthcare. Thank you for joining us.
Thanks, Eric.
Along with Bill Dries, reporter with the Daily Memphian. I guess I will start with you, Dr. Haushalter. It has been, it seems like 100 years since you were on the show. I'm pretty sure you were the last show we did in the studio some 100 years ago in March. And where we are now is where? I mean, the case rate is rising really rapidly, but I think everyone is cautioned, that's disconcerting, but there are more tests. So that's not necessarily the key indicator, but the ICU capacity, the acute care capacity in the hospitals, that is hovering around 90% as we tape this Thursday morning. How concerned are you, and what do we do next?
Clearly, we're concerned. We know that there's ongoing transmission in our community, and it's actually stretching many of our systems, not just the healthcare systems, but our public health system and even our testing capacity. Also, we know that COVID is going to be with us for a while, so we have to think in marathon mode and really focus intentionally on what are the interventions that are going to have the most impact, but also have the least broader impact unnecessarily. So an example is closing limited service restaurants as opposed to all restaurants, and trying to focus on those behaviors that we know will contribute to ongoing transmission in our community.
Is it time, as some people have talked about, to really, in terms of the reopening plan and the phasing, we've paused, but is it time to roll back some of these openings? I mean, obviously bars and we're shut down, and there's a fight about that we may get to. You talked about limited service restaurants, but is it time to take even more dramatic steps in terms of shutting down office spaces and going back to a stay-at-home order and so on?
So at the current time, we're not encouraging going back to a stay-at-home order. We have always really encouraged alternate work solutions. And so when an employee can work from home or remotely, we are encouraging that, and that's been continued from the very beginning. We have taken some steps backward, and that's specifically in focusing on limited service restaurants, which in the state of Tennessee is equivalent to a bar. We will be looking at some other specific areas like Beale Street. Beale Street has an exception zoning because it's a historic area, and what is happening on Beale Street and what we might need to do there. But the other thing that I think is very significant is we did implement the mandatory masking right before the 4th of July, and we know mask usage is going up. And while our numbers are going up, they're holding fairly steady the last week or so at around 400 new cases per day. So we'll continue to monitor that before we take additional steps backwards.
Let me bring you in, Dr. Threlkeld. When you look at the numbers, are you concerned? Are you very concerned? I mean, where is your take on where we are in terms of case rates, positivity rate, infection, and so on?
Yeah, I mean, the numbers are sometimes difficult. If you look at any one parameter, you can sort of get bogged down, and we've all everybody's heard many times the advantages and disadvantages of looking at one type of number. The case rate can depend on who you're testing. The case number can depend on how many you're testing. So there are a lot of things that you have to look at sort of all at the same time. I think my biggest concern moving forward is one, putting it into historical context. If you look at 1918, look at 2009, the influenza pandemics that are most talked about, there was a more moderate wave that occurred in the spring. And then it came back to a much more severe wave when you look at the winter of the next year. And so when you see that happening, you run the risk really of getting into a situation, if we let this go on and we don't do enough social distancing, we don't wear masks when we're close together, those kind of things, you could see the second wave never really being a second wave. It can be a continuation of the first wave. And that's when we see influenza thrown on top of this, when we see the potential, carrying on of the virus cases in schools, it just continues in the community to a point where when the flu hits us, we could then reach that point of overwhelm that we've been trying so hard to avoid, and that we've had advantages to be able to avoid. The spread out nature of our city, the fact that we got at this earlier than some cities. So we're sort of in a window period right now, I think, that we have to take advantage of. And if we don't, then we really could be in a problem.
And before I go to Bill, I mean, one more. So taking advantage of that window involves what? Masking, continued emphasis on masking. But again, is it more shutdowns, or is it, what can individual people, families, and businesses do to, as you said, take advantage of this window?
I think it's simpler than sometimes it's put out there. I mean, Europe does a better job of this than we do. If you're not, the masking is very important, but what I don't want people to miss is the social distancing is probably the king of this. I mean, if you sit next to somebody on an airplane, you both have masks on, it can be complicated. We don't know whether you're going to get it or not. If you're not on the plane, you're not going to get it. And so you look at the social media and the big gatherings and the parties over the 4th of July, people hugging, they're not wearing masks in their backyard at their parties. So I think one of the huge keys is to maintain the social distancing. If we can just do that, the low-hanging fruit, we stop those so-called super spreading events, and that really fuels a lot of the disease in a lot of communities. I think just those things could be a tremendous boost in getting rid of this virus locally and nationally.
Let me bring in Bill.
Dr. Haushalter, where do you think we are at what I would call the art of coexistence in this all? The precautions we're supposed to take and the things that we're able to do now that we weren't able to do initially in this?
So we do know it's in the community. I noted that earlier. So coexistence is, I think, a good approach or a good terminology to use relevant to COVID. I want to reinforce what Dr. Threlkeld said. It is those decisions that each of us make that are going to make a difference. And particularly avoiding large crowds. I'm not necessarily hosting a party that you may have wanted to host at your home, but making really sound decisions about avoiding contact with others so that we reduce transmission. And that is how we coexist with any virus, whether it be the flu or others that we know or circulate in our community. Good hand washing is also critical. We cannot underestimate the importance of hand washing. And then also, I want to reinforce the importance of protecting our most vulnerable populations, particularly our seniors, and making good decisions about visiting our seniors. I use myself as an example. I have an elderly mother. I still have to go, take care of business for her in Nashville, but I wear a mask when I'm there. I limit the time that I'm there. I don't take grandchildren there. We try to see other ways for her to be connected or socialized so that she's protected from others. And I don't, I visit multiple people and then go visit her. And so those are the things that I think will allow us to coexist, but also reduce transmission, particularly as we get into the fall, as was noted in winter, because we will have flu here as well. I really want to promote people getting their flu vaccine, but we know in Shelby County, we don't have good uptake on flu. So this is a year we really want to push the importance of vaccination for flu for anyone above 6 months of age.
Mm-hmm. Dr. Threlkeld, does the concern about the flu, does that kind of play into what you're thinking about a second wave that really isn't a second wave in all of this?
Absolutely. I think that's one of our biggest dangers right now. I mean, the examples I gave from 1918 and 2009, they were flu, right? So the pandemic was the flu. Now we have a pandemic plus the flu. And we don't know how severe the flu is going to be this year, just like every year. We could have a flu pandemic for that matter. I mean, there's just a lot of unknowns. We do know there will be a lot of disease. There always is. And I absolutely, Dr. Haushalter's point is key. I think we need to have a record vaccination campaign for influenza this year. That, to me, is the biggest potential concern for overwhelming hospitals, is just to have a continued sort of array of COVID cases that we can't quite clear, and then we have the flu on top of it. And I think, as she also said, this disease is like a body of water sort of flowing through our community, and we need to take steps to channel it to the extent, even if we can't stop it, though we can do a lot better job than we've done, I think, individually on that. But if we can channel it away from nursing homes and the most vulnerable people, that all by itself will be a huge win and will allow us to, we just need to get to the vaccine. We hope. There's a lot of encouragement. That's a different topic. But if we can just be smart until some other modalities are available to us to help us in this disease, it'll be a big deal.
And before this goes back to Eric, talk a little bit about where your hospital is at, where Baptist Healthcare is at, because we hear so much about ICU beds and supplies, and that was an issue at the beginning, and then there was preparation and there wasn't. Are we where we were at the outset of this in terms of how taxed hospitals are in their capacity?
Well, there are actually probably more cases now than in some of those situations, but I think we've had several opportunities to prepare, thankfully. And we got to look in sort of horror sometimes at what was happening to New York as it hit them the first in the country. They didn't have the opportunity that we've been blessed with to prepare. And I think we as a city and as the hospitals have indeed prepared. I think I know I'm proud of what our hospital's done. The leadership has built many new negative pressure rooms, opened up some new ICU rooms, been sort of first to attack the technology at the new medications that are available in town, in the region. We've beefed up our ECMO capabilities, the artificial lung capacity for people who have really acutely damaged lungs. But, I think moving forward, we have to be careful, though, because even in good preparation, you can't outrun a pandemic that is allowed to get out of control. So it's why I think we spend so much time trying to continue to blunt the curve. That, after all, was our first our first instruction, was to keep healthcare from being overwhelmed. And I don't care how much you plan, we can't let this thing kind of smolder on because that can be a problem. But so far, I think the hospitals have, in general, and ours in particular, certainly also have done a very nice job of beefing up the capacity to take care of people. And it's also important to say that having some cramped bed space is not an unusual thing for hospitals. We can have that in the summertime, in the wintertime particularly. We have to wait for people to be discharged to have elective procedures come in sometimes. So that's kind of part and parcel of the daily business of a hospital. But when you have wintertime levels of problems now, with the wintertime looming in front of us, then you have the potential for a situation that's much harder to stay on top of.
Let me switch to and go to you, Dr. Haushalter, a question heavy on so many people's minds, which is the schools. And what is the right answer? Should and let's kind of break it down of maybe kids under 10 years old and kids older. I mean, there's some differences in this, and we'll get to colleges in a minute. But should elementary schools be opening, given it's not that kids can't get it, and it's not that they can't transmit it, and it's not that they can't get sick, and you've also got adult staff in the schools? What is the right answer there?
And I don't think there's a perfect right answer. What we do know is that it's really important for children to be in school for a variety of different reasons. So it is balancing a variety of different perspectives and determining for each school district what's best for that school district. There is significant guidance that's come out from the American Academy of Pediatrics, as well as the Centers for Disease Control, and then at the state level, the Tennessee Department of Education. And the consistent message is children do well in school. We know that we have some children in different communities that don't have access to food. They may have other social or emotional needs that aren't met if they're not in the school system. And so the goal is to get children back to school as safely as possible. What's important for the schools is that they need to understand their unique situation, their school children that they serve and the families, but then have flexibility to be virtual or on site so that families can have choice. And then if there is increasing number of cases, our capacity is overstrained and there's a need to be completely virtual, they can do that quickly. So flexibility is going to be the answer. Then also to focus specifically on children who may have special needs and working to assure that the school's setting is there and prepared to meet the needs of those particular children, and setting up specific plans for those children with their families to make sure that they can successfully transition back into the classroom. And if masks are going to be worn, that those children can successfully wear masks or have some alternative in the classroom.
How much does there's a growing conversation about it, really a kind of crisis of childcare. So school is obviously first and foremost education and social emotional development. It is also on a pragmatic level in a country where there are so many two-parent working families. It's an economic necessity for so many families. Many preschools, child care centers around the country have just been shut down. Where do things stand in Shelby County in terms of the availability of, again, childcare, not schools, to working families?
So interestingly, in Shelby County, and I think it is because we have the joint task force and so many partners are coming together to address COVID locally, is we have had daycare available or childcare available for essential workers throughout the pandemic. There may be limited slots from time to time, but I can speak specifically to the YMCA. They were open from the very beginning to have childcare for essential workers. And for a significant period of time, they had capacity that wasn't being utilized. So there are resources for childcare. If people have questions, I do encourage they can call 211. And through 211, there's a connection to what childcare services are available for their child's age.
And before I go to Steve, have you all seen any concerning numbers or cases coming out of the child care centers that have been open?
So we have had children who are in child care that have been diagnosed with COVID, but frequently upon the contact investigation, it's been determined that they actually contracted COVID in their home setting, not in the child care setting. But that's something we're going to continue to watch closely. And as schools open, we clearly will watch closely. There's not a lot of evidence around transmission of COVID from child to child and child to adult. The information that's been available has been during the time that children have been at home, not in school. So we anticipate learning a lot as schools get back to business in the next few weeks, actually.
Dr. Threlkeld, let's switch. I'll throw colleges in your direction. Colleges have tried, or many different colleges, different approaches. I think Rhodes is doing all virtual. I think, did U of M say that they're going all virtual? And other schools I know of are doing a hybrid where it's optional if you want to come into socially distanced spaces. What's the right answer with colleges?
Yeah, let me just, if I may, just make one additional comment too. Sure. About secondary education. And I think Dr. Haushalter dealt with that beautifully, and flexibility is going to be key. But I would say there are a lot of people to protect in this equation. The students are probably the easiest. They're not going to get very sick, many of them. But it'll be hard to screen them too because they don't get sick. It's hard to find the cases. But we have to protect, as she mentioned, faculty, administrators, and we have to protect the elderly relatives that live with the students that are going to these schools. And the recent South Korean study suggested that that 10 to 19-year-olds transmit the thing perfectly fine, much more like adults than young kids. So I think that the one thing that strikes me in talking to heads of school is that we focus very heavily on preventing the cases in the school. And that's true. We space the desks, we wear masks, we do all those things that everyone should do. What I think is going to separate the people who are the most prepared is going to be, what do you do when the inevitable failure of that occurs? Because the question I get is, there's one, what happens when you get your first case? No, it's what happens when you get your first 50 cases is what you need to prepare for. How do you isolate those people? How do you quarantine them? That dovetails into the college issue because there's the added equation of dormitories and student life that is very difficult to control. And I think that we worked a good bit with Rhodes College. Dr. Haas was amazingly prepared for all that. We had a lot of discussions before she made the very difficult decision to go to online learning. You have to have adequate places to put people and quarantine them if they are positive. And in a college situation, that can be a lot more challenging. You may need an entire dormitory building to house those people before it's over in that situation. That's just going to be a lot hard for a lot of institutions to do. And I think it adds a layer of complexity for colleges. I mean, Harvard, other people have gone to all online. So clearly that's something that's weighed pretty heavily on the administrators.
All right, let me go to Bill.
Dr. Haushalter, we've talked some about the influenza epidemic of 100 years ago. And there is a proposal now to bring back a public health board for the Shelby County Health Department. I believe it will be part of that. Can you talk about that? Because it sounds like that board is part of what you've talked about as the marathon of responding to where we currently are.
Yes, and thank you for asking that question. In Shelby County, we had a Board of Health previously, and that Board of Health was dismantled in 1911. As I became the director, I actually asked a lot of questions. Why don't we have a Board of Health? I'm accustomed to a Board of Health. They have a very specific role. And one of the roles of a Board of Health locally is to bring other knowledge and expertise to the table, particularly from clinical medicine and academia, veterinary medicine, nursing, and so on, so that public health officials are making decisions but have information from other partners. And also, those partners then can advocate for the role of public health, which is complementary in the healthcare system. You know, clearly we focus on hospitals and healthcare systems, but we oftentimes forget the complementary role of public health, that prevention piece. So it really creates a nice linkage between those two areas. And as we've moved forward through this pandemic and we have had the joint task force, it's been the right time to revisit the role and the need for a Board of Health in Shelby County. That board will serve as an advisory board to the director, myself, as well as our health officer. But then they also are advocates and champions for primary prevention and to speak to public health. So we know that the vote will be on Monday. Our hopes are that the board will be approved and we'll be able to successfully move forward quickly with the board.
All right, and it sounds as if this board has in place some of the forces that have been brought to bear on the pandemic. I mean, is this an outgrowth of kind of the process for making decisions in the pandemic?
It is an outgrowth, but I would say it's about timing as well. I've always valued having a Board of Health. I spent many decades in Nashville. We had a very strong Board of Health. They were strong advocates for public health practice, helped us have linkages to academia, but they also had a regulatory role that enhanced the role of the health department. And so we also can rely upon that board to assist with making decisions in a crisis like a pandemic relative to restrictions that would either complement or enhance the decisions we can make as either director or health officer.
I'm curious, and I'll go to you, Dr. Threlkeld, as a doctor, as a scientist, infectious disease expert, how much, if at all, does the economic pressure and the economic considerations of this shutdown weigh on your decision-making? I mean, this is obviously first and foremost a health crisis, but it's also become a recession. It's created tremendous economic pain and for some individuals and families, crisis. I'm not talking about the inconvenience of not being able to do certain things. I'm talking about, food insecurity and all that. How do you weigh that in your assessment of the situation?
Yeah, it's very difficult. And most of my day from early morning until late at night is taking care of individual patients. So in that sense, I have the luxury of being able to focus on that. And I don't have the difficulties that Dr. Haushalter and politicians have on a large scale and having to make decisions that have an effect on that. So I focus most of my day on the individual care of individual patients. But it has to affect everybody. I mean, we see people suffering in a long way. And those things have public health implications, obviously. We've seen suicide rates go up. We've seen drug overdoses. Those sort of things are important in a lot of ways that affect not just the public, but individual people that we see come to the hospital because of those things. So it weighs heavily. And I think the difficulty of people who are making the political decisions have to look at health advice, and then they have to look at the advice based purely on those things and weigh them. And I think it's extraordinarily difficult because we have to find a middle path. And that middle path is, particularly in this day and age of political sort of unrest in terms of just polarization, it's hard to get to that point, I think.
Similar question to you, Dr. Haushalter. I mean, how much do you feel the economic pressure? I mean, the real economic pain that people feel, how much does that weigh on you? And then secondarily, how much does the national political debate about this, it has become a politicized issue, how much does that weigh on your decision-making?
So clearly economics is a big factor that we consider, but also things like social connection. is important, particularly for children or seniors and so on. So when we make a recommendation, and let me just talk about process, I'll try to be relatively quick. I'm going to reinforce that Shelby County having a joint task force allows for multiple perspectives on the issue and when necessary, robust debate, so that when a recommendation is made to the elected officials, and actually those recommendations are generally made by me or one of our team members, but typically me, to all 7 mayors, city mayor, county mayor, and all the municipal mayors. And we have good discussion about what are the alternatives, and then strive to implement what is the most appropriate intervention to reduce transmission, but minimizing as much as possible economic burden, social burden. But also then within the joint task force, we have a lot of wraparound services.
Yeah.
The food bank is at the table, there's housing assistance, rental assistance, and so on. And so making sure as a community, we strive to meet the needs of our community, knowing that there are consequences to all of the decisions.
All right. Well, thank you both. We could talk much longer, but that is all the time we have this week. Thank you for being here, and thank you for joining us. Remember, you can get past episodes of the Behind the Headlines on the WKNO website, or you can download the full podcast of the show from the Daily Memphian site, wherever you get your podcasts. We'll see you next week.